Good afternoon, everyone. My name is Christy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, the Honourable Ian Rankin, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Chrissy, and I just want to repeat my condolences I gave yesterday after Cabinet. We lost a Nova Scotian yesterday in his 30s, the youngest yet in Nova Scotia, and so again, on behalf of Nova Scotians, my condolences go out to the family. Today we are reporting 15 cases, new cases today, the majority in HRM. That's 9 in the HRM area, the first time in a while that we were able to have single digits reported. Similarly in Sydney, the eastern zone had 6 cases, so that takes up the 15 cases between Halifax and Sydney. These are good numbers. You will see some fluctuation over the next number of days we expect, but this is good news. And it's thanks to all of you for following the protocols over the last little while and for continuing to get tested. Testing does continue to be a strong part of our response to COVID. I want to continuously say to everyone, this is really important, especially as we open up in our first phase, to get out and get tested, even if you don't have symptoms, to find a pop-up and go in and get tested to protect your family and friends. I know a lot of people are frequenting the patios, and you should be supporting local. Just continue to be safe, and testing will be a way that we continue to limit the spread of COVID in our communities. We will begin testing at the airport it's expected for Tuesday. All travelers who arrive at the airport will get a self-swab testing kit, and we'll also have health staff on site to support those that can't self-swab. And Dr. Strang will provide more details about the testing program at the airport. I do want to make clear, though, this test does not replace the requirement to self-isolate upon entry into our province. One negative test does not confirm that you do not have COVID. We have been working on a policy to support our rotational workers who are moving in and out of our province on a regular basis. And again, on Tuesday, we'll be starting a new policy. Those who have received their second shots so that they're fully vaccinated will be asked to take a number of tests, including one upon arrival. They will not have to self-isolate because they have those two doses of protection, which they will prove, and then they'll have the test requirement. Those workers who have had just one dose will have to isolate, but only for a modified time for 7 days, not 14, as long as their tests are negative. And again, Dr. Strang will provide more details. I do want to thank our rotational workers for their patience as we work to accommodate them. I know they do a lot of difficult work, and I know it's challenging to be away from your families, and I know I could just imagine how much you need to see your family when you come home. We just needed strict protocol in place, especially when we had spikes of cases, to make sure that we were watching the hot spots. But we worked, the public service worked really hard to find a way to accommodate, and we heard you. There were a lot of emails about those, especially that have 2 doses of vaccine. We always try to be fair to look at what's coming forward and how we can best accommodate and keep our community safe and your families safe. So hopefully this will help as you travel back and forth to where you need to go to work and coming back into your home province. And with that, I'll turn it over to Dr. Strang.
Thank you, Premier. Good afternoon, everybody, and happy birthday, Chrissy. The Nova Scotian who died yesterday was the youngest person taken by COVID-19 in our province. It is incredibly sad, and I would like to offer my deepest sympathies to the family and loved ones. Please honor those who have died by getting your vaccine. It could save your life, the life of someone you love, or someone who has been serving their community throughout this pandemic. The vaccine is our way out. It will be a while before COVID is gone, if ever, but the vaccine will allow us to live safely and more normally with the virus. Our vaccine rollout is going very well, thanks to Nova Scotians. Our first dose coverage rates are high and continuing to climb. And I'm relieved to see Nova Scotians coming out in droves to get the vaccine and posting their smiling pictures on social media. And to younger Nova Scotians who have recently become eligible for vaccine, we need you to keep the trend going. Socialize carefully until you've had 1 dose. I know you want to hang out with your friends like you used to, inside without masks and distancing. This is coming, but please, not yet. Right now, get your first dose and socialize in small, consistent groups outside. And for everyone, first dose is only halfway there. It's equally important to get your second dose, and we are starting that process of offering second doses next week. I want to focus more on testing for a few minutes. As the Premier said, testing has been a key to our pandemic response, and Nova Scotia has done very well. Behind the scenes, we have a number of teams that have established a world-class testing program. And Nova Scotians have shown their commitment through their willingness to get tested. But testing will not stop with vaccine. Far from it. Testing is critical as we move through our reopening plan. It's the only way to know how much virus is circulating, especially without population immunity from 2 doses. It's a key indicator to help determine whether we can safely move between the 4 phases of our reopening plan. So don't stop getting tested because case numbers have gone down or because you've had your first dose of vaccine. As you go back to work, school, and other activities, you need to make regular testing part of your personal reopening plan. And the more you're out and about and the more contacts you have, the more frequently you should get tested. We have also been working with employers and the federal government to pilot a workplace testing program across the province. Almost 50 employers, as well as the Halifax Chamber of Commerce, have signed on. They get free rapid point-of-care tests, training, and support to help them set up testing programs in their workplaces and ensuring that they're appropriately reporting information on cases to public health. On-site testing in workplaces helps keep them safe, quickly identify cases and possible outbreaks, and supports faster economic recovery. We will have more details over the coming days on our plans to expand this program and how we will make it available to more employers as we move through our reopening plan. Along with the vaccination status, testing will remain a key part of loosening border restrictions. And I'm pleased to announce a new approach for rotational workers. It will give them relief from the difficult circumstances they and their families have been in throughout the pandemic. Not only have they been required to isolate for 14 days every time they come home from work, but they have been unfairly criticized and stigmatized. And I thank rotational workers and their families for everything they have endured over the last 15 to 16 months. So starting Tuesday, June 8th, the vaccination status of rotational workers will determine whether they need to isolate when they come home to Nova Scotia, and testing will remain a key part of this approach. So rotational workers will be asked to provide proof of vaccination while completing the Nova Scotia Safe Check-in application. They will then need to continue to be tested at multiple points throughout their first 14 days in the province. We've been doing this for a while, and we're going to continue with the testing for now. Here's how it will work. Assuming the worker has no symptoms and has been vaccinated at least 2 weeks before arriving in Nova Scotia, those who are fully vaccinated with 2 doses will need to get tested but do not need to isolate at all. Those who are partially vaccinated with 1 dose must isolate for 7 days and get tested. If they are coming from an outbreak site and are partially vaccinated, they must isolate completely away from others until they get a second negative test result by day 7. If they're not coming from an outbreak site, they must isolate until they get their first negative test, and then they can switch to their modified isolation for the remaining part of their 7 days. And either way, once they get if they've had 1 dose of vaccine and they've done their 7 days and have 2 negative tests, their isolation ends. If people are unvaccinated, then they have to follow the existing protocols for isolation. We will continue to communicate directly with rotational workers in the coming days, and we're in the process of updating our website with more information as well. In the meantime, if you're a rotational worker and you haven't gotten a first dose of vaccine, I hope this motivates you. We're also starting passenger testing at the Stanfield International Airport on June the 8th. This will make it more convenient for travelers arriving by air, including rotational workers, to complete their first test. Travelers will get a self-swab kit and instructions on how to complete their test. If they arrive during the day, they will do their swab on site, and Nova Scotia Health will have staff available to help if necessary. If they arrive in the late evening or overnight, they will take the kit with them to where they are self-isolating. And the swab has to be done within 48 hours and then dropped off at a primary assessment center. I want to clarify that these tests are PCR tests like those used in our primary assessment centers, and travelers will get their results within 72 hours. Right now, this testing does not replace the need to self-isolate. The self-isolation requirements will change as we move throughout our reopening phases, but for now, most people coming into our province still have to isolate for 14 days. In closing, I want to mention that the tie that the Premier and I are wearing today, it's a special IWK Telethon tie from the IWK Foundation. The IWK Telethon is back this Sunday, June the 6th, with a virtual broadcast. And this year we'll celebrate the power of community that has been so clear over this past year. So maybe you can watch a bit of the telethon, make a donation between outdoor visits with friends, enjoying a sunny patio, or visiting a local retailer. Everybody has worked hard, and that's why we've got control of this virus. You've followed restrictions, gotten tested, and you're now getting your vaccine. Keep it up, and we will have a summer together.
Thank you, Dr. Strang. We'll take one question and one follow-up in the time that we have for today, beginning with Jean LaRoche with CBC.
Oh, hi. Sorry about that. Oh, God, where's my question? There it is. All right. My question is for Dr. Strang. What's your recommendation in terms of carpooling as we move through the different stages of reopening things as outlined in the provincial, back to normal plan?
So we need to look at carpooling as the equivalent of being indoors. It's close contact, shared airspace. So right now we're saying that the house indoors can only be around other household members. So if you're carpooling, it would have to be with other household members. Once we get into the phase 2, then we're going to open up to further, and then there would be the ability to have carpooling with people who are outside of your household.
Go ahead with your follow-up, Sean.
Thank you. Dr. Strang, over the weekend, the press release said there was still limited community spread in Sydney, but since Monday, those same releases have talked only about community spread in the central zone. Can you give us an update on what's happening in Sydney and kind of where we're at with that?
Yeah, we for all along in Sydney, we've said that the cases and any spread has been really focused in a specific, very very clear geographic and demographic group. That there's been only a few cases beyond that group. In the last number of days, really what we're seeing in cases in the eastern zone, if you will, are close contacts of previous cases and some related to travel. So really, and we continue to do lots of testing, especially in that geographic area, with us specifically focused on the age demographic. So we're really not seeing at this point in time any sign at all of spread in the broader community in the Sydney area, and we're coming to the end, I believe, of the even transmission within that specific group.
Next, we'll go to Jonathan McGinnis with CTV.
Hi. Thank you for taking my question. I guess probably for Dr. Strang. Dr. Strang, is Nova Scotia considering a walk-in, no-appointment vaccination strategy similar to what we're now seeing in New Brunswick?
No, absolutely not. One of the hallmarks, and I think it's success of our program, has been we have a central booking system that means that we can actually match up specifically the amount of vaccines that we have with specific appointments, which means that people don't have to line up. They have certainty about their appointment. We twice a day that's looked at, and we're managing appointments and vaccine, and we can redeploy it in areas of the province that we need to have. We're seeing perhaps some concerns around decreasing uptake. So I think maintaining that central booking process makes the most sense. I fully believe that's going to actually allow us to move rapidly, more faster as we enter second doses than other provinces, because we have that ability to very tightly manage vaccine supply with appointments and be flexible within that with potential in specific groups. As we get down the road, if we get to the end of that approach and there are certain areas that need specific attention, we may start to change from that process. But at this point in time, our overall approach is allowing us to have rapidly increasing vaccine coverage. And we are not seeing indications of decreasing demand for vaccine like New Brunswick is having.
Go ahead with your follow-up, Jonathan.
Mr. Premier, this one is for you. What is Nova Scotia doing to compete with the 20% travel discounts that we're seeing in New Brunswick and PEI?
We have discussions that will continue as we have been with the industries that have been most significantly impacted by our third wave shutdown. So that includes tourism at the top of that list. So we'll continue. Minister Kasoulis has had discussions just as recently as yesterday with hotels. I'm going to continue to listen to some of their ideas they're putting forward on how we best support the sector, and that would involve marketing and looking at other ideas and how we best provide financial support.
Next, we'll go to Alicia Draus with Global.
Thank you. Just talking about the testing program that's kind of launching at some workplaces. Can you just elaborate a little bit about what types of workplaces are signing up for this so far, and is this program voluntary for workers?
It's certainly voluntary for the workplaces. It would be up to the employer about whether they require require testing or not. I don't believe any of them are. This is using rapid testing that being supplied part of the federal government, and we have a process that all positives then have to be referred immediately to one of our a process, so they can then get a confirmatory PCR test done. And we also have a process that any of those positives are then making sure that public health is well involved. It's been going on for a number of weeks, and we have a range of businesses. Many of them are larger employers, but a variety of types of businesses are involved. And as I said, we're looking to increase the range and the type of businesses through this program in the weeks and days ahead.
Go ahead with your follow-up, Alicia.
Thank you. Of the individuals who have passed away this wave, we do know that 2 of them had their first vaccine, and you've said that these are breakthrough cases. Can you just clarify further if the 2 individuals who had their first vaccine, had they had that vaccine for at least 2 weeks before falling ill? And can you just describe what you mean a little bit more by breakthrough cases?
So I can't speak to individual cases, but we now reporting weekly, and we have updated numbers in our release. So a breakthrough case is somebody that has been at least 14 days from the time of receiving their first or their second dose of vaccine. Because we know, so let's take an individual, certainly within that first 14 days of their first dose, they're still very susceptible to COVID. And so the definition of a breakthrough is 14 or more days. And what we've seen in the report that was released today, that of our overall cases that we had, 4.8% of those were people who had 1 dose of vaccine, and 0.6 were people who had 2 doses of vaccine, and similar percentages for hospitalizations and low numbers of deaths. One death in somebody who had 2 doses of vaccine, at least 14 days. after receiving the vaccine, and 2 of the deaths were people who had had 1 dose of vaccine at least 14 days prior to that, before they got exposed to the virus.
Next, we'll go to Keith Doucette with the Canadian Press.
Good afternoon. Dr. Strang, I'd like a little more context for those numbers. What do they mean? I mean, they're just numbers. So can you put them in context in terms of what you were expecting and what we see in this province? And can we compare it to anywhere else that we know of yet?
So every province is looking at this. We're consistent and comparative. So what it means is that first of all, we expect to see some breakthrough cases, as I've explained before. That the vaccine is not 100% for any one individual, and there are going to be some people who, despite being considered fully 1-dose vaccinated or 2-dose vaccines, they will still have some cases in those individuals, but it'll be a small percentage of the total number of cases, and there will be hospitalizations, and occasionally there will be deaths. So we're starting to release those numbers. Also, people can understand this is expected. We will see those numbers. It does not at all mean that the vaccine is not working. The vast majority of people get good protection from the vaccine. There are some who don't get as good protection, especially older people, and people with underlying immune conditions. That's one of the key reasons why we have to have high levels of uptake in the overall population, to protect those around us who may not individually respond as well to the vaccine.
Go ahead with your follow-up, Keith.
But I guess what I'm looking for, are these numbers high or low or in the middle based on what we know? What do you make of these particular numbers? Or is it still too early to see a trend here?
What I make of the numbers is that our percentages are roughly, all provinces are starting to collect this immunization. It's been, we're starting to get enough numbers. We're there, as I said, having a small percentage of breakthrough cases is not a surprise. We're not seeing a percentage that would say that we have a problem with the vaccine at all. Again, all these numbers are actually consistent with what we expect to happen. And what we will see as our total number of cases and therefore hospitalizations and deaths come down, as we get a greater and greater percentage of the population who are immunized, by nature, a greater percentage of that shrinking overall number of cases and hospitalizations and deaths will meet the definition of breakthrough cases. But the overall percentages will remain small.
Next, we'll go to John McPhee with the Herald.
Thank you. This was for Dr. Strang, and I'm going to continue with the vaccine status numbers. One number that jumped out at me, the people who were hospitalized who weren't vaccinated, is in the 88% range. Could this be attributed to just a matter of timing in terms of these people didn't have a chance to get their shots, or are we talking about people for some reason who didn't get their shot? Do we have any idea there?
Well, these are numbers that we presented from March 15th to June the 1st. So there's going to be a lot of people in there who, who may not have had a chance to get vaccinated. There could also be some people who may have chosen not to get vaccinated. We don't have the breakdown at an individual level about why somebody may or may not have had a vaccine. So it's going to be a combination of both of those, knowing that where we were with our vaccine program in March the 15th is very different of where we are today.
Go ahead with your follow-up, John.
Thanks. And this is again for Dr. Strang. There appear to be quite a few vaccine bookings still available, at least in the Halifax area. I'm wondering particularly about the 12 to 15 age group and whether you're happy with the uptake in that category.
So we have a check-in every day with the vaccine team. They look at a supply of vaccine and vaccine appointments twice a day, and keep so we're keeping a very close eye on that. We are going to start looking at a more detailed breakdown of our vaccine by more local geography and different age groups with our vaccine strategy team, and see overall we're making very good progress, but we need to keep an eye on where we might be seeing signs of a slowdown. We've already done that in a couple of circumstances where we had small communities in parts of the province where we were seeing that there was a decreasing demand for vaccine, and we worked with our pharmacies and physicians and in those communities and created a demand for vaccine and got them back on track.
Next, we'll go to Lindsay Armstrong with All Nova Scotia.
Thank you. Hi there, Premier. I'd like to know a little bit more about how you're planning to manage welcoming Atlantic travelers into the province after New Brunswick and Newfoundland open up to all Canadians. You mentioned yesterday that proof of Atlantic residence will be required. I'm wondering how this sort of process at the land borders will be managed.
So we still have a number of weeks before we get to where we're going to be able to entertain this as an option. That's phase 3. So far, our case numbers are looking good, so that we should be able to get to phase 3 around the proposed June 30th date. And we'll have more to explain the process at the border. Those discussions are underway.
Go ahead with your follow-up, Lindsay.
Thank you. A question for Dr. Strang. On offering second doses to those who received AstraZeneca, I'm wondering how many of those emails have gone out and how many bookings have been secured. I've heard from a number of individuals who are still waiting after having received their AstraZeneca shot quite a while ago now.
As we said on Wednesday, that call-out is going to start happening next week.
Next, we'll go to Tim Biscay with the Halifax Examiner.
Hi, good afternoon. Most of my questions have already been answered. I do have, well, I'll just leave it there. Thank you.
Okay, thanks, Tim. We'll move on to Kyle Shaw with the Coast.
Thank you. Dr. Strang, first, super duper close look clarification at the breakthrough numbers. I'm still confused. Obviously, unvaccinated people includes people who've never had a shot in their arm. But does that also include people who've had one shot but it's before the 2 weeks?
Correct. When we say people who don't meet the definition of a breakthrough case, it's people who have no vaccine or they've had a vaccine within 14 days, either first or second dose, when we break it down by dosing. So, and that's simply because we know that it takes, in healthy people, about 2 weeks, and some people longer to start to get a good immune response and protection from the vaccine. That's a standard definition that is used across the country, and it's a similar type definition. That the number of days would be different, but depending on the type of response from a vaccine, it's a standard way we would define a breakthrough definition, regardless of which vaccine you're looking at.
Go ahead with your follow-up, Kyle.
Okay. Thanks. Thanks for that. So, Dr. Strang, it was only a couple weeks ago we were here, and you were talking about the medical system being at very stressed by the number of COVID patients. These numbers are trending down. Is the medical system out of the woods yet?
So we're certainly the pressure from COVID is decreasing, and I know there's discussions going on about how to start to reopen up other non-COVID related healthcare services. Always like that, like everything, we need to be slow and careful on that. We need to, we're still in a space that if we move too quickly, too fast, or open up too broadly, we run the risk of another surge. So we need to make sure that we're not going too fast in the reopening of the healthcare system so we have capacity in the coming weeks if there is another surge.
Next, we'll move to Pat Healy with the Laker.
Hi, thank you. This question's for Dr. Strang. Many couples have weddings on hold for a second year in a row. What's your message to them? When can they hold one of the biggest days of their lives with friends and family?
So I recognize the importance of those celebrations, along with other milestone events, and all of those are going to need to follow the gathering limits that are allowed through our different phases. So we are having much more detail on our website around the details of including gathering limits that'll be up on our coronavirus website, and what is likely to happen at each of the 4 phases, which take us to the end of the summer. So I would encourage anybody planning a wedding or any other kind of event to look at that website, because it'll give you a guideline on the size of the gathering, the number of people that could be allowed at whatever phase we might be at during the summer.
Go ahead with your follow-up, Pat.
Also, a question for Dr. Strang. It's June. There are many parents wondering what the plan is for graduations. What does that look like?
So I know that education is working on plans, specific graduation plans, celebrating the academic achievements of students, and those will be done within the allowable, public health guidelines. And that's going to be, knowing that we're going to be in all likelihood phase 2, and what's allowed under phase 2. So public health is working with education on those plans. For anybody, community groups doing celebrations of graduates, I'd come back to my previous answer. Whatever is done will have to be done within the what's allowable and under the in whatever phase we're at, and it's likely going to be in phase 2, where we have very limited ability, very small numbers for indoor and outdoor celebrations. I know that's unfortunate. People are disappointed, but it's large social gatherings are very high risk for transmitting COVID, so we have to reintroduce those very carefully.
Next, we'll go to Blair Rhodes with CBC.
Yes, thank you. In the news release that you issued just a few moments ago outlining the airport testing, it's described as voluntary. I'm just curious, is it not going to be mandatory for people to get these COVID tests when they arrive in the province?
No, it's not going to be mandatory. It's going to be there. We're certainly going to be encouraged and setting it up in a way that kind of incents people to getting the tested. But we don't have mandatory testing for most categories of travelers at this point in time coming in, and we're not planning on making that mandatory even as we introduce testing on site at the airport.
Go ahead with your follow-up, Blair.
Thank you. Earlier, you indicated that there was some communities that you saw the shots, the vaccines, trending downward, and you had to sort of intervene. I was wondering if you could specify where you saw that problem.
So I don't have the detail. I don't actually recall. I'm not being disingenuous. I don't actually recall the names of the communities. But what I do know, I think the story is that we monitor vaccine uptake at a pretty local level carefully. And when there are signs that we need to put more emphasis in a specific community, we do that. And in the communities involved, it was successful.
And that's all the time that we have for questions today. Go ahead, Premier.
Thank you. And just further to the vaccine program, I am very impressed how it's rolling out across the province. To date, we have 621,660 needles and arms, and I was able to congratulate a team in Dartmouth just the other day for surpassing the 600,000 mark. That means by the end of today, over 60% of our population will have received their first dose. 72% of our population has either received their first dose or has their appointment booked for one. And we're ahead of schedule for the second doses. 16,000 emails have gone out to individuals that are eligible to book their second shot. And many have already received their second shot or have booked the appointment already. If you were due for your second shot and haven't left your email, so that's if you're between June 24th and July 3rd, just call the 1-800 line if you did not provide that email. Next week, we have planned 67,000 doses to go out into ARMS, and I wanted to give a shout out. We talked about age categories. The 12 to 15-year-old categories are doing very well. 67% of them either have their shot or their appointment booked. And as you move up towards the higher end of the age brackets, we have 85% vaccination of first shot for Nova Scotians ages 55 and up. So that's great. We do need to do some work with the category in between those that I fall in, actually. So we're looking at between ages 15 to 40. which happens to be our most active social age group. So I want to just reiterate to all of those in that age category and all Nova Scotians, it's really, really important to get out your first for your first dose of vaccine, and then your second dose will be well on its way, and that will help with our reopening plan together with testing. I'd like to see the coverage across all age groups continue to grow as we continue to do well as we roll out our vaccine, and I want to thank all Nova Scotians for getting your vaccine, and I want to especially thank those that are working at our clinics across the province. I know you're working really hard, and the work that you're doing is super important to get us through this third wave. We still have to follow the protocols, but getting your shot is the best way to protect your loved ones, and it'll help us get through the phases as planned. So congratulations to Nova Scotians for getting us through a very difficult month of May. I hope that you're enjoying the first phase of our opening and getting out to patios and getting together to see friends and family you haven't seen in a while. So have a great weekend, and I encourage you all to support our local businesses who have gone through a very tough time.